Thank you very much, everybody, for joining us today. We have Professor Shu joining us from Chicago. Professor Shu is a clinician researcher who specializes in sickle cell disease. Today, he is going to talk to us about sickle cell disease in general and new treatment for sickle cell disease. Please hold all questions at the end of the talk. Without further ado, let's invite Professor Shu.
Thank you.
All right. Hello. Hello, Texas. How are you guys doing?
Good.
Fine, okay.
All right. So we have, looks like about 12, 15 people there.
Yeah, we have more logging in. Actually, we are just more than 4.
All right, great.
Others are logging in at home.
Okay. So I'm a pediatric sickle cell doctor at University of Illinois in Chicago. This is my fake backdrop showing Chicago on a nice day. Today is like a little bit rainy, but not too bad. And I take care of kids with sickle cell, do research, do global health and advocacy, and also volunteer with the Sickle Cell Disease Association of America. I've gotten to know Dr. Mubiru for, I think we've known each other for like more than 10 years.
Yes.
Something like that. And I'm really, really pleased that he has taken on the interest of you guys and that you're teaching STEM to secondary school students. And so what I'd like to do today is introduce to you a little bit of the some of the teaching tools that I use. I assume that you know some things about sickle cell already, so this is going to go a little bit fast, mostly to show you some possible approaches for teaching your students, the after-school programs and things like that. So I'm going to see if I can share my... And you're recording, right?
Yes, we are recording, yes.
Okay. Where'd it go? Can you see my screen?
Yes, we see you, but we don't see the screen, but we see you, yes.
Okay. Okay, how about now?
Oh yeah, we see you, but we don't see the screen.
Oh dear. All right.
Okay.
I'm going to try to...
And the technical guy has left.
One more thing here. Well, this may be more of me doing visual aids. Let me see. There's one more way that I can do this. I can send to you, Dr. Mabiro, the PowerPoint, see if you could pull it up there.
That would be, let me see, let me call the guy back.
Okay, and in the meantime, just
let me call the guy back. Okay, let me see this. Okay, 888 634.
one more thing here on Teams.
Yes, we wanted the Scott to come back. We have technical issues. Or somebody log in at your end. We can't see the slides. We have what we have a talk. But I think James Crowder is on, and then Scott. Steen and we are 342. Yeah. Scott has been here. Yes.
I think I'm getting it.
Bye-bye.
Okay, it should be in your email now.
Okay. Yeah, but I don't know accessing my email right now. Okay, there will be what you continue. Just start until when I get some technical guy over here.
Okay. Are we getting something now?
Yeah, we see you.
Okay. So,
Oh, yeah, okay. We have the slides now.
okay, great.
Yes,
It says overview of sickle cell.
yes. Overview of sickle cell disease. Yes.
Okay, oops, I got extraneous views here. Okay, I apologize. The
No problem.
Teams is not something I'm do that much. Nope. Okay, well, you have some extra stuff on the side. Sorry about that. This is just so you know, this is, you guys are college students, but this is actually prepared for medical students.
Okay, fine. It's okay.
All right. So this is an overview of sickle cell disease. Here's my disclosures. I do some consulting and other research,
Yes.
just so you know. And the hallmark of sickle cell disease is this severe acute pain. And this artist named Mr. Hertz-Nazier was painting what he meant when somebody asked him, how bad is your pain? And he would say 10 on a scale of 10. And this is painting named 10, showing that the pain is so severe that basically he is not able to have anything else on his mind except his pain. Tears rolling down his eyes, screaming, and all his thoughts are just about red blood cells. Some of them are blue because they're deoxygenated. Some of them are normal shape. And so this is what sickle cell disease can mean when things are very severe. Why is there such severe pain? Well, some of the reason is that there is a blockage of the red blood cells flow. And I'm going to show that to you guys with some visual aids. And this is something that you could do in a secondary school type of setting too. So you can pretend that this stocking, can you see the stocking?
Yes.
We'll pretend that this is oh, we got background here. I don't know how to mute those guys.
I need to find to
Okay, so
background.
So here's the stocking, and the job of this blood vessel is to deliver oxygen from one end to the other. And we'll pretend that this is a red blood cell, squishy, kind of smooth. You see how it's smooth? And it's going to try to go through this blood vessel. Do you think it's going to make it?
No, that will.
Maybe. So with a little bit of blood pressure push, it's going to go all the way through, and it fell down to the floor. So it delivered the oxygen to the other end. And if you have a slightly smaller red blood cell, that can do that too, maybe a little bit easier. So it all went through. However, if you have a sickle red blood cell, it's shaped more like this, or like a banana. And do you think this banana is going to make it through the blood vessel?
No.
Maybe it can. So that actually went all the way through. But sometimes if you have a real banana, then it'll get stuck. Or if you have still a wax banana, you'll get it in here, and the blood vessel is harder for it to negotiate, and it gets really kind of hung up in there. You see this blockage? So this blood vessel is not going to be able to deliver things. And if more red blood cells try to come in after that, they're sort of stuck too. So that this would be a blockage of the blood flow. And now this blood vessel can't deliver oxygen downstream. So the tissues down below cannot get oxygen. That leads to this very severe pain. In addition, the sickle red blood cells can be fragile, represented by something like these. These are guajillo peppers from the store. Dried peppers, if you have dried peppers, can you see these? They're kind of shaped like a sickle red blood cell too, but they're kind of brittle too. And so when they break, they'll release their contents, which is exciting, hot, spicy, maybe painful to eat. And just like that, when a red blood cell breaks, you have also release of hemoglobin that's inflammatory to your system and can be damaging to the blood vessel and the blood cells. This can lead to the blood vessel having not just blockage like this, but also tight, vasoconstricted, because the nitric oxide is not being able to get released, and you have blood vessels that can't even have normal red cells go through. You can also have, because of sickle cell problems, you can have cells that become sticky. So it just like you put adhesive tape on this. Can you kind of see this stickiness? So this trying to go through a blood vessel also can have blockage and problems. And so this, I can't even get it into the blood vessel now.
Just click that check mark.
Yeah, we had, but it's not working.
So whenever someone pops up like that, you can just pull up the people. If you click on this right here, and then you'll see who is trying to get in, and you can let them in.
Okay.
Mhm.
So this blood cell, even though
like
it's
you?
not sickled, is also getting stuck. You
Mhm.
see, it's kind of stuck because of the adhesiveness. And so these properties are now part of the new understanding of sickle cell disease, that in addition to the shape, there's also adhesiveness, there's hemolysis, there's tight blood vessels, vasoconstriction, but you can fight some of this with better hydration, with more fluid intake. And so carrying a water bottle around with you can be helpful. I'm not trying to advertise the water bottle, the brand. Drinking a lot of water even when you're not thirsty is something that we try to teach the children with sickle cell disease. Because if you can open up this blood vessel wider, shown here by my hand, dilating this stocking, then I can manage to get even the sticky blood cell to pass all the way through. And so now I've cleared the blood vessel because of the vasodilation. And you can dilate with more water, more prayer, with heat, relaxation. And so those are all things that we're using for therapy now. So those are kind of the old therapies for sickle cell. What are some of the new therapies? So there's 4 medicines now that are FDA approved for making sickle cell disease milder. Like I said, this is a presentation tuned for medical students, but I'm giving it to you guys anyway. So these 4 FDA approved medicines shown here in these different columns, hydroxyurea, L-glutamine, voxelotor, and crizanlizumab. These are the generic names, and then you have the brand names up top there. And we can show these to families and say, you know, in addition to drinking water and relaxing and keeping your blood cells from getting deoxygenated, these are some things you can do so day to day your sickle cell disease is milder. And this is a new advance compared to just a few years ago. The 3 columns to the right here, they were all approved since 2017. So pretty much in the last few years, these have been new advances. And they've come because we've learned more about what kinds of things happen in sickle cell, so that the voxelotor is trying to block the sickling from happening. So is the hydroxyurea. The glutamine is trying to improve the oxidant stress, not have as much damage from the hemolysis that occurs. And the crizanlizumab is trying to really inhibit the adhesion properties. So that these are working in different kind of ways. And there's still more medicines being tested. Each of them will have its side effects, its issues, how it's delivered could be different. Some are liquid, some are injection. Some are for pregnant women is okay, some are not. That's shown in this row here, that hydroxyurea is not something you should take during pregnancy, but glutamine is fine during pregnancy. And then the crizanlizumab and voxelotor have not been tested during pregnancy, so we just say not recommended. Then we go on to tell people that sickle cell disease is not just about pain, but other organs and other problems can arise too. So that this blood vessel not delivering oxygen to the other end, if it's very severe and extreme, can cause the pain. But you could also have silent problems. that even without pain, there could be damage to your immune system, to your lungs, have caused stroke, brain problems, kidney problems. And so having these kind of treatments available really has made some difference in trying to preserve those different organ functions so you don't have as much difficulty later in life. Some of the things that we use as teaching tools include mnemonics like this, trying to say that infection is one of the problems in sickle cell. So can we teach families about this with a pictorial, kind of an infographic? Recently, I've been fooling around with maybe just a jingle, like if your temp's 101.4, you got to get out the door to the ER. 101.4 out the door. Not sure if that'll work because it's still, we didn't get the exact temperature rhymed precisely. So maybe they'll think it's 100.4 or 104, but 101.4 out the door is what I'm going to be trying to push. How we doing?
Yeah, we're doing fine.
Okay. Sickle cell disease is something where there's newborn screening as one of the advances. And why do we do newborn screening? Because sickle cell disease may not be detected until problems really arise. And so screening all the babies, whether they're named Jamal or Gabriel or Lynn, all need to get screened for sickle cell disease. And so that's part of normal nursery type of process now throughout the United States, all 50 states. Now, here's a quick quiz. Is sickle cell disease only in people of African origin? True or false?
False.
People said false?
Yes, yes.
All right, you got it. And sickle cell is a genetic condition, and there is a health benefit of having sickle trait. So if you don't have sickle cell disease, but you have sickle trait, then you're more resistant to malaria. Why is malaria big a deal? Because there's these guys, these mosquitoes that look something like this. Can you see this? This is a mosquito from our bookstore that carries malaria. I'm going to try to see if I can change my camera setting a little bit here to be more dramatic. Okay, so I found this other mosquito from the museum. Can you see the size of this guy?
Yeah.
It's like bigger than my head. This mosquito from the Field Museum store in Chicago shows that mosquitoes not only will bite you, shown by his female mosquitoes that are biting you. They're the sort of lancet type of shaped thing in the front that's very sharp and little spreader things to spread your skin apart so it can get to you. But it's carrying in its crop these other kinds of passengers. And so this mosquito is carrying possibly dengue fever, possibly malaria, could be carrying in its stomach part, maybe West Nile virus. Can you see that? And maybe Zika virus. And so this visual aid of a mosquito carrying a bunch of things in it, as it's moving from one person to the other, is going to pick up from one person, transmit it to the next person it bites, because in its crop is all this stuff, and the mosquitoes have this nasty habit of regurgitating a little bit into you before they suck. So mosquitoes carrying these things, and I think you guys don't have to buy these. You could probably make this if you have a little bit of craft skills. And I know that your topic currently is STEAM, S-T-E-A-M, so you have the arts in there too. So sickle trait can actually help protect people against dying of malaria. They may still catch it, but less chance of dying. And so having sickle trait is a survival feature, sort of a Superman feature in areas where there's a lot of malaria. It is a myth that only African Americans get sickle cell disease. In reality, it affects people from lots of different ethnic backgrounds. Here's a global map showing more dark, more, I guess this is like reddish colors, red-brown colors showing where there's more sickle cell in the world. And so there's concentrations definitely throughout much of Africa, but also in Central and South America, the Caribbean, United States, India, Middle East, a little bit down here, even in Indonesia and Malaysia. So I know that there's a sickle cell center in part of Malaysia. Sickle cell, where was it first described, was actually this gentleman who came from Grenada to Chicago to become a dental student, because as a Black man, he wasn't allowed into dental schools most places, but there was a dental school in Chicago that took him. So he traveled all the way from the Caribbean up to Chicago. And while he was in dental school, he had these mysterious pains that wasn't an infection, and it wasn't rheumatoid arthritis, and it wasn't cancer. And they did this new test called looking at the blood under the microscope, and saw cells that look like this, where some of them are more normal shaped red cells, but some of them are elongated, curved, something like this kind of stuff, or banana shape, but they called it after the farming tool called a sickle. And so that's what it was named. And he was described in the published literature from his time in Chicago. And he successfully graduated from dental school, became a dentist, went back to the Caribbean, to Grenada, to practice as a dentist, and eventually passed away. But he already did manage to become a professional person in the upper end of society in his island. So using the terminology of that time, they said that this is the description of this case. So was it discovered in Chicago? Well, actually, West Africans have been discussing sickle cell disease for centuries. And so depending on which country you're in, there could be different languages with names for this condition that would affect children with severe pain. And some of the names for this in the different languages I can't pronounce, but most of these sound sort of like the cry, the repeated cry of a child with a lot of pain. But the one in the lower left corner here, Obanje, I think is the way to say it. I don't speak Igbo, but that one is describing children who come, die early, and then come back again, sort of reincarnated. And that is a very mystical kind of thing. And this is felt to be probably a description also of sickle cell disease, where there's early childhood death, and it runs in families. And so that's why the next kid might have this too. And so in some places in West Africa, East Africa, there is probably this description. It just wasn't written down. It wasn't published in a journal that could be indexed in PubMed or something like that. But there's been big advances in sickle cell in my lifetime, maybe a little bit before you guys were born. But from 1986 on, there was a big, huge advance with having newborn screening and early childhood introduction of penicillin to prevent infection. This helped children to survive into adulthood, not having to be Obanje and dying at an early age. And so having newborn screening shown here with this little heel stick, you see little drops of blood being collected on a filter paper. And so that is a standard newborn screening test. It's done in the United States, most other countries where there's a lot of sickle cell. Life expectancy for sickle cell disease, if you see back in the 1920s, 1940s, 1960s, was all below 20 years old. Mm-hmm. And it's only when you get up into the 1980s and 90s has it managed to become something that adults with sickle cell have. And so there's a big, huge gap in life expectancy between children with sickle cell disease and children without sickle cell disease in the American population, something like a 30-year gap in life expectancy. It's still, this chart ends at the year 2000. Sorry to say, it hasn't gotten hugely better since that time. It's kind of leveled off. But again, the hallmark of sickle cell disease is the severe pain episodes, and there's different ways to illustrate this. A 0 to 10 scale, again, a painting, or photos for children who can't express themselves very well. There's ways to depict also what are the health issues, and many of them are issues of burden of disease, that somebody's carrying a burden of chronic disease every day, like a gigantic boulder on their back, or that there's disparities in rates of stroke or life expectancy or medical expenses. But it used to be all bad news. Now there is good news. There's ways to address these health inequities by making progress with treatment and cure. So here's a picture of the Sickle Cell Center adult area in my place. The pediatric area is similar, maybe not quite as shiny as new, but having centers dedicated to sickle cell care, having cures, potential cures of this genetic disease is happening. And so this young man on the left-hand panel is getting ready to have a bone marrow transplant or peripheral blood stem cells. And the donor for these stem cells is his little sister, shown in the right-hand panel, where she is donating the stem cells by having one arm out, both arms out. One has blood that's going out of her body, shown here with the heating pack on her arm. And then the other one is blood coming back to her body. And where it's going is through this machine shown here near the corner, and it's collecting blood in this bag. Can you see this bag kind of up hanging in the sky? That is collecting some of her stem cells from the peripheral blood, and it's sending the rest of her blood back to her. And so by being hooked up to this machine for an hour and a half, maybe 2 hours, she's providing a bag of stem cells that can then get infused into her brother. I don't know if you can see this line that's sticking out of his chest. Big here, central line. So they will be eventually going into there. He's been prepared with chemotherapy and with other immunosuppression to accept this transplant of cells from his sister, where the outside of the cells look the same as him because they're siblings who inherited the same surface features. The HLA surface markers are the same between these two siblings. But they differ on the inside because her cells make sickle trait red cells. They don't make sickle cell disease red cells like his did. And so she was able to then cure him, basically, and he went on to have a successful transplant and he joined the military. He no longer had a chronic disease. She, by the way, she's just doing goofy 10, 11-year-old kid looking at a camera kind of thing, making a face, but her stem cells will grow back. She's not like losing a kidney or anything permanent. She just has 2 holes in her arms. She did have a little bit of medicines to help to mobilize the stem cells to be more numerous so that they could be collected in this way. And this has been done over 2,000 times. And now there's also gene therapy that if we have time, we can talk about that too, which is incredibly cool, trying to adjust the DNA in your own stem cells so that they don't make sickle red cells anymore. The research is continuing in sickle cell with more than 12 medications that are still in clinical trials. So I talked to you about 4 that are approved. There's others that are in this pipeline that are yet to be delivered to full FDA approval. And they're getting tested in mice, they're getting tested in lab, and then they finally get tested in people. So there's many, many more besides this 12 that are being tested in laboratories such as with Dr. Betty Pace, getting tested in mice. But we also deal with communication issues and problems of understanding. And so if a new mother is being faced with a newborn screen result, sometimes the new mother says, "What are you telling me? My baby looks fine. I don't see anything wrong with them. What do you mean they have a disease?" Somebody with disease, with sickle cell disease, I've seen those adults. They look thin, they look yellow in their eyes, they have pain. My baby's not showing any of those problems. So I don't want to deal with it. You are wrong. I'm not coming. Forget it. Stop calling me. So we have to deal with communication issues, and we have to figure out how to say, we can't just leave her alone, because we do know that having the prophylactic penicillin, having the preventive penicillin can help block infections and really save lives. So we need to get this message through to her, but we try to work on how to do that communication. Some other times, me as a doctor and my team would be working with a young adult, perhaps, maybe about the same age as you all, but has had a stroke due to sickle cell disease, has had brain damaged by blockage of blood flow. And this makes her not able to organize herself very well. Maybe her memory's not so good. But at 20 years old, she moved out of her mother's house because she said, well, this is what 20-year-olds do is they move out. But now she's missing appointments and she's missing the van, or she wakes up not in time. And sometimes appointments are like one is at 10 o'clock and another's at 10:30 and she can't make both of them. So she's late for one of them. So how do we help her to organize things? There can be school issues with sickle cell where, like I said, having fluids is really, really important. But will every school let you just drink fluids whenever you want to? Can you have a bottle of water on your desk if you're a third grader? Maybe not, because the other third graders may try to throw it at you, or you spill it and you make a mess. So persuading the teacher that really this is part of their health condition is something we need to write notes and make plans. Similarly, rest breaks in gym. If you have a chronic anemia, your endurance is not so good. And so how many of you guys remember doing in gym class something called like shuttle runs, or I think they used to call them some other kind of name, where you just have to run back and forth across the gym as many times as you can with a stopwatch. And if you don't run a certain number of laps, then you get a bad grade. Well, what if you just can't because you have a chronic disease? Does that mean you're always going to flunk gym? Or should you have some sort of accommodation, exercise at your own pace? Some schools in Chicago are cold, so you have to watch out for temperature. Some have 3 floors of stairs to climb up. And if you have poor endurance, that may be a challenge. And then others get bullied, or they have absences, or they look at their eyes and this kid has yellow color to his eyes, and so he gets teased, and the kid might try to put on dark sunglasses in the daytime indoors. And so what happens if a kid puts on dark sunglasses and he's walking around indoors? What's going to happen to him in school? Probably get at least teased, probably get ordered by the teacher and the principal to stop doing that. But delayed puberty is also part of a chronic disease. And so if you are in 11th grade and you haven't hit puberty yet, and you're in the locker room or you're just walking down the hall, how is that for you? How is it for your social life? How is it for your self-esteem? Do you get thrown into lockers, or do you just get no dates? All these kind of things. So all kinds of things are necessary for part of the medical care. And a lot of it is not just the medicines, but how your whole life situation is like. There's guidelines, there's information. Some of the colorful things here shown are from the Centers for Disease Control, cdc.gov. And some of them are English and Spanish. I'm still trying to learn more Spanish, but you can see on the left-hand side, that's giving information about the genetics of sickle cell. And they have a diverse set of couples. Some are named Raul, some are named Kwame, some are named Christina, all kinds of different colors and situations. If you ever wanted to show somebody about genetics of sickle cell, you could go to that and show it on your phone, and it scrolls very nicely. Let me see how we're doing for time right now.
You're fine.
Doing okay?
Yeah, you're fine.
Okay. So another thing is that there is this situation where some of the things I described is that there's visible health conditions and then there's invisible ones. So if you go into a store and you see somebody in a wheelchair and they're struggling to reach the box of cereal that's on the 5th shelf, you might help them because you recognize that they have a disability. But if you go into the store and you see somebody struggling, but you can't see that they're in a wheelchair and you can't tell that they have a limitation in their arm movement due to sickle cell pain, do you help them? Maybe not. Maybe if you're a really nice person or very observant, you might do that, but it's not quite so likely. Similarly, so this past month I was moving stuff from my mother-in-law's place to another place, and I'm 64 years old and my hair is thinning and I'm struggling with some heavy thing. And people actually, strangers, would stop and try to help me because I must have looked pitiful or something, carrying a desk or carrying a heavy box. It's like, sir, can I help you, sir? I appreciated it, but it was a visible issue of being elderly, you know? But if you have an invisible thing and you can't carry the heavy box because of a chronic fatigue or muscle problem or pain, you may not get that. Some other invisible disabilities you may have heard of would be like heart attacks. You can't see a heart attack from the outside. Menstrual cramps, menstrual issues you can't see from the outside. So you have to just explain yourself, and some people don't always want to explain. There's this other condition called multiple sclerosis. I don't know if you guys have heard of that, but that and sickle cell disease are known for this unusual intermittent pattern where some days are good days and other days are not. So if you go in and you say, oh, I need help, a person may say, you know, I saw you 2 days ago and you were fine. What's the matter with you today? Why would you need help today and not 2 days ago? So in these intermittent things, it's not like every day is a bad day, but some days you might need help. People heard of the opioid crisis? Opioid overdose?
Yes.
So here's an older picture of the rate of deaths from opioids, with the blue line showing non-opioid and non-sickle cell disease opioid-related deaths. And there's some places like in part of Boston where there's so many people getting overdosed from opioids that I have friends who carry not just naloxone with them, they carry 2 naloxone because in any walk to the parking lot, they're liable to meet 2 people passed out on the sidewalk about ready to die. And if they just have 1 naloxone, it's not enough to be able to rescue the second person. Can you imagine how many overdoses that is? But here's the orange line on the bottom showing sickle cell and how many deaths there are from opioid with sickle cell. So it's not 0, but it's definitely not rising. And so people from sickle cell are not being killed so much like the general population is having unfamiliarity with opioids and using street drugs. People with sickle cell are getting prescription medicines. They're using them for their pain, but they're getting painted with the same stereotypes or the same side eye of, yeah, right, you need all this pain medicines because you have pain. I can't see that there's anything wrong with you. I just see that you're a young Black male in Chicago and you want to have pain medicines. Aren't you really just getting high? Aren't you really just selling this to somebody else? I'm not going to give you these medicines because I'm not going to perpetuate the opioid crisis in America. So you're not going to have anything for your pain. What are you going to do? And that is the thing, that's the message that some people with sickle cell get. So there's a lot of stigma, bias, stereotyping, and unjust withholding of treatments because of the opioid crisis. And even in a ward or emergency department setting, one of the things that people do is try to figure out how bad is your pain anyway. So, you know, I'm in pediatrics. Some of my patients are too young to talk very well, but they may be laying very quietly in bed. And so the nursing scoring of this child's pain could be like, okay, patient says they're in pain, or if mother says the child is in pain. Is child thrashing? No. Is child screaming? No. Is child moaning? No. Child just wants to have more pain medicines. Why would I do that? But I think what it is if you've never had pain before, you might be thrashing, screaming, etc. But if you've had pain 20 times in your life that's this bad, one of the things you do is you try to distract yourself or put yourself somewhere else, and find also that thrashing and screaming raises your epinephrine levels, makes things hurt more. And so laying quietly in bed is actually a sign of how much pain this person's having. So the kid that doesn't want to go to the playroom, doesn't really want to eat, those are also signs of pain. All right. This is more for medical students and stuff, that there are published guidelines now, some of them extremely recent, just in the past few years, that help to describe to different people, different doctors who may not be familiar with sickle cell disease. Here's a guideline. Here's some things you can do. And some of these are on apps, such as shown here. Some of these are on websites, shown here. This website, incidentally, is made for a community hospital. So cover everything from snake bites, you see the snake, to sickle cell disease, so that somebody who may not see this medical problem all the time could know what to do with it. So in Texas, maybe they see snake bites a lot. In Chicago, not so much. Things like that. Okay. I'm going to pause and see if you have questions.
Questions?
The opioid person.
Yes.
He was saying something about like when he's walking, he always has two. What was the medicine he said?
So somebody's asking about, you talked about somebody walking with two medicines in the parking lot because of the opioid crisis in the US. So she's asking, like, what is that? What's the medication you talked about?
So the medicine is called naloxone. Let me see if I can put it in the chat. And it's basically a reversal.
Narcan has the brand name, and the other one is the generic. So I was asking, is it similar to Narcan?
Exactly.
Is it similar to Narcan?
Oh, okay.
Yeah.
Okay, Narcan, okay.
You got it. You got it
Yes,
exactly
yes.
right. Yeah. Narcan
Okay.
is a brand name. Naloxone is the generic.
So doctors work with that, like doctors moving out in the parking lot, you can have two to help other people. That's what you're talking about.
Yeah. So my friend is an emergency medicine doctor, and she carries two Narcan naloxone injector things with her.
Oh.
So that it'd be something where you basically, if you find somebody passed out, you just stab them with this needle and it delivers a dose, kind of like an EpiPen type of idea.
Kind of.
Yeah.
Yes, somebody has a question. Let me get a question. Yes, speak louder.
I can't hear anything.
Yeah, say it again. What is it? So she's talking about the people with sickle cell, like taking more of the opioids and the overdose. Is it common? Is that a question kind of? Okay, so do people with sickle cell taking more of the medication of the opioids and they do overdose? Is it common? Is it?
No, not common. So that's part of the message, is that for those who are overdosing and dying in the street, most of that, I would say like 90% or more of that, is street drugs of unknown purity, unknown origin, unknown dose, where people with sickle cell disease are taking opioid medicines that are prescribed for them, that are they're dosed for them, and they themselves know that they can run into problems if you have too much. So they will kind of stop at a certain level of dosage because they know that it's going to cause them to have difficulty. What opioids do is they'll have sort of layers of dose and effect. And so there's some certain layers that give you some pain relief and not too many side effects. Others will give you a little bit more pain relief, but you're starting to get some side effects with sleepiness, with itching, with constipation. And then you go higher yet, and there's more pain relief, but there's also suppression of your breathing. So you breathe more slowly. And if you look at somebody next to you and you count their breathing, in a regular classroom, an adult probably is breathing at 10 or 15 per minute, breaths per minute. But if you are on opioids, you might go down to like 4 or 5. And if you go down to 0, basically stop breathing, that could be something that happens if you have too much opioids. But by that point, you're also very, very, very sleepy. You probably would have difficulty bringing another pill to your mouth. So the opioid overdoses tend to be somebody who's getting the opioid injected, where they give a large dose and they don't even have time to stop. They just get everything all at once. And then that can kill them because it gives so much that they get high and respiratory suppression one after another. And if you don't breathe for a while, then you die. The Narcan can reverse that by blocking the opioid receptors so that you would no longer have the high, you would no longer have the respiratory suppression, you would no longer have the pain relief either. And so it would reverse all of that in the big doses of naloxone, Narcan. Does that kind of answer your question?
Yeah, somebody has a question. Yes, Julita.
That patient do at that time, if they're unable to take the actual dose, the actual medication that is for pregnant women.
Yeah, did you hear the question?
Nope,
No.
could not hear.
Yeah, the question is about medications for pregnant women. The student was asking that she saw that there are 4 medications, only one was approved for pregnant women, and the other ones were not recommended. Now, what if that the patient doesn't cannot take that medication? Is there anything else they can take? Is that a question you need to?
What's the next therapy?
So for that patient who can't take the only medication, so a patient is pregnant and she can't take that medication, so what do we do?
That's a really good question. You're thinking like a doctor. So there's a couple different solutions. One is to get through the pregnancy with not on medicines. Another is that blood transfusions is another therapy. And so sometimes people who are going through pregnancy are on blood transfusions for the period of the pregnancy. And then finally, there have been some people who went to transplants or went to gene therapy and then had children after that. Now, going through transplant or gene therapy also impairs your fertility, makes your eggs fewer, makes your sperm fewer. And depending on the type of transplant or the type of gene therapy, it could be reduced by a lot. So that last option of going through a curative therapy and then going to have children is not something where the odds are with you, but it is something that people can do.
Yeah, thank you. I have a question, and the question is about the new cures for sickle cell disease that came out in December, and the cost. I don't know what's your take on that? Is it helping? I mean, with the cost again, I don't know, but the cost I've heard was in millions, something like that. Is it still like that, or there's been some change?
Yeah. So I'm trying to find where my slides went. Oh well, but I just did show you, by the way, a little inheritance demonstration featuring little bags and having things to pull out of there. So the cost of sickle cell gene therapy has been listed as $2 million for one of them and $3 million for another one of them. The insurance companies are starting to say that they will pay for that. Exactly how they'll pay for that is still getting worked out, but Blue Cross Blue Shield has said that they're going to work out a plan. Medicaid has said that they're going to work out a plan. And so there is quite a bit of hope that it could be covered by insurance. In the same kind of way, bone marrow transplant, which I was showing you the picture a little bit, is up in the neighborhood of $400,000, $500,000. But from a matched sibling donor, like you saw in those pictures, that can be covered by insurance too. And so the analysis has been that if you have a comparison of the lifetime costs of living with sickle cell disease spread out over a few decades compared to the one-time costs of going for a curative therapy, it actually is a good return on investment to do that one-time cure, that you get the savings of not having to pay for decades and decades of ongoing medical care by taking this person through transplant or gene therapy, and you pay a lot of money up front, but then you save things later.
Okay, thank you. Any more questions? Any questions?
Oh, and I'm sorry. And one feature of their payment plans is something called an outcomes-based payment, where the payment may not come up front. It may be like, well, we'll wait. We, Blue Cross, we will wait until day 100 of the transplant and see how you're doing. And if the transplant has not gone well by day 100, we may not pay the provider of this treatment. And so it makes the doctor and the hospital really want to have success. And then at day 200 or day 400, they would pay another installment kind of thing.
Okay, we have a question. Yes. We say it again. So the student is asking, what are the things you would tell you as a doctor, sickle cell patients to avoid? What are some things?
You mean lifestyle kind of things?
Yes. Lifestyle, yes.
Yeah. So don't do street drugs. Don't drink too much alcohol. Those will cause your body difficulty. Smoking, not a great idea. Try not to get exhausted. So probably don't be signing up for a career that's heavy manual labor. So carrying bricks or digging trenches or something like that, or working out in the desert, not such great career options. You want to have something that's more like an indoor job, something that you use your brain and you can sit and you can go to the bathroom if you need to. You can get medical leave if you need it. So working in a bank, working as a professional teacher, accountant, these kinds of things. Military is probably not something to aspire for, because if you have an intermittent problem, what are you going to tell the rest of your platoon if you're sick and they can't count on you at that time that you're under fire or something, or you're about to jump out of a helicopter? So there are some limitations. Some of it is more like healthy living and living moderately. The number of limitations are getting fewer and fewer as we have better treatments, but there still are some things with a chronic disease.
Thank you. Yes, we have another question. Yes. Yeah, before, she's asking about before newborn screening was introduced. How did they know somebody has sickle cell disease?
Oh, that's a really good question. So they would wait until the baby showed up with some problem. And so this is a picture of one of the things that would be the first sign of sickle cell problems. This is a young child. You can see how young he is, right? Maybe like 1 or so. And his blood flow to the hands has gotten so bad that the hands are suffering cell damage, and they're causing swelling and pain. And you can see how shiny his hand is. He no longer has wrinkles there. And the other hand is kind of shiny too, but not as bad. And you see how unhappy, you can imagine how painful that is. You can sort of see that the bases of his fingers are also swollen too. And so this is called hand and foot swelling. This might be the first sign. And this pain can be so bad that we might need to give morphine to a preschooler, to a toddler. So that was one of the things that made people show up with sickle cell pain. sickle cell problems was this first type of pain. The other big unfortunate things would be irreversible, things like a stroke as your first sign. And so in some places, the rate of stroke in children with sickle cell disease can be 10, 15%. Can you imagine 10% of children just having a stroke? And so there would be schoolroom with multiple kids who are not able to use one arm, or their face is drooped, or they have cognitive problems, brain problems because of stroke. And then the other would be, again, irreversible, would be death from infection with bacterial infections, Streptococcus pneumoniae, infection with malaria, salmonella, diarrheal type of diseases would kill somebody with sickle cell quicker than somebody without. And so the estimate would be that in some places without newborn screening, the death rate of children under 5 with sickle cell would be 50% to 90%. And they would find, by estimates of how frequent the gene is in this region, the sickle trait was common in this region. And they'd calculate, just by the odds of how many people marry each other with sickle trait or don't have sickle trait, how much chance there is of having a baby with sickle cell disease. And they look in this region and they say, so how many babies are there with sickle cell disease? And there's babies missing because they had died. And so they never made it to age 5. And so in many places where there's no newborn screening, there would just be a lack of people with sickle cell disease because they died. It was terrible.
Okay. Any more questions? Yeah. Yeah, we have one more question. Yes.
Okay, so I went to school. Can you hear me? Can you hear me?
Hey, can you hear her? She's asking a question. No.
Okay.
Mhm.
So
I
I went to school with 2 siblings that had sickle cell. How common is that? Like, where like immediate family members get that trait?
say it again. How is
I went to school with 2 siblings that had sickle cell.
Okay.
How common is that, like, for immediate family members to like contract that trait?
so he's
Well-
asking about go ahead.
So I'm going to do my little demo really quickly here. So here we're going to pretend this is a mom and a dad, and each of them has 2 genes, and one is sickle trait and one is normal hemoglobin. And the other one also has 1 gene for normal, 1 gene for sickle. And if they have children, every pregnancy is a new chance of whether the children both have sickle gene, shown here, or will they have normal?
Okay.
And every chance is just random. And so if you keep on having children, you would have any possibility. And there's some families where I know some families with 3 children with sickle cell disease, 3 out of 4. Other families where they both have sickle trait, the parents have sickle trait, and there's no children with sickle cell disease. So it's completely random for each pregnancy.
Yeah, random. Mhm.
Yeah.
Uh,
And so this is, if you guys are teaching STEM, this is an illustration that you could do. And with very cheap materials, sometimes it could be balls that are different colors. Sometimes it could be start candies that have different colors, but the same feeling.
Mhm.
So when you reach in there blindly into the bag without looking, you can just have kids do this, and it can be a demonstration of probability and genetics. You can make little graphs, you can make a histogram, and they can see how random things are.
Thank you very much. Any more questions? I think, I don't know if you have any question in the chat. There are some people who logged in on what, let me see, chat. Any questions? Let me see. Questions? Questions. So one student is saying that what you showed us with the bags would be a good thing for the STEM. When you have STEM activities, the bags with a random picking out the genes would be a good thing to show.
Yes.
Yeah. Okay, I think we are done. Maybe one more question. Other than that, we'll be done. We thank you very much for giving us the time to talk about sickle cell disease, and whenever we have time, we'll get back to you and ask you some questions. But other than that, we are done. Are we good? Good. Okay, let's give Professor Shu and applause. Okay, thank you very much. And I guess, Dr. Shu, I see some people who logged in here from what? From Uganda. I saw some people, I know the names. So a couple of people logged in from Uganda. Yes, yes. Okay, thank you very much. Yes. Okay.
So, and I hope that you guys can do teaching with some of these kind of demonstration stuff too.
Yes, we will. Yes, we will use some of those, especially the ones with the bags. We'll try that one first, and then the other one with the chili pepper.
Okay.
With the dried chili pepper. Okay. Thank you.
Thank you.
All right. Thank
very
you.
much. Okay. Good.
Thank you.
Thank you.
Thank you.
Okay. Thank you,
Thank you.
everybody.
Appreciate it.
And thank you.